Happy Tuesday and welcome to Let's Talk Justice, JFJ's radio show on the Bridge 99 FM. I am Jade Williams from Jamaicans for Justice, and I am joined this week by
Sharika Mills. I'm an attorney and I'm the Policy and Advocacy Coordinator at the Jamaica Youth Advocacy Network.
Right, so this week our topic is exploring sexual and reproductive health rights of children and youth, right? So we're kicking off Child's Month. It is Child's Month, right?
Yes, it is.
Okay. So is it that we have this entire month full of activities just for children?
Yes, this month we're supposed to be focusing on children, activities for them, focusing on their issues and advocacy around the issues that affect them as well.
Awesome. So, Jamaicans for Justice will be covering a couple of relevant topics over the month, and we're starting with sexual and reproductive health. But before we get into the substantive topic, I do have to cover our Human Rights Minute of the week. So we have a couple of alarming things, and on the theme of children, actually, is a proposal coming out of the Ministry of Education for an amendment to the Child Care and Protection Act, and that proposal is to allow for a minimum 20 years served by a child having been convicted of murder without the consideration for parole. So, of course, at Jamaicans for Justice, we had a very strong opinion on this. I don't know if you were able to see our article in the paper last week, Sharika, or any of the listeners. But Mikhail came out on the front page of the Glean on Thursday. Yes. Absolute madness, she termed it, and I have to agree.
And we agree as well.
That's Jayan's position as well.
As well, yes.
Yes, I can imagine, when you think about, I'm not going to say what it is because it's coming up in our trivia, but when you think about what the age of criminal responsibility is and how early a child can be implicated in one of these offenses, but also I think what is missing from the conversation is the additional vulnerability of children. I don't think we can afford to get to a place where we are thinking about children in the same way as adults in terms of their ability to be rehabilitated, in terms of their ability to be steered in a different direction.
And even in terms of the circumstances in which they become involved in crimes, it's usually not of their own volition, and they usually do not have enough agency to, imagine these crimes, create the circumstances for these crimes to happen. And there's usually a lot of adult assistance that's required to do that. And so I think at least there needs to be that consideration before we decide their culpability and what should happen to them in terms of the law. Absolutely.
And, it's just a part of our general trending. We've pointed it out quite a bit at Jamaicans for Justice. It's just a moving towards mandatory minimums, moving towards removing the judicial discretion in cases that we think it is essential to have judicial discretion. So, it's something that we will continue to advocate against. It's not a amendment that we support. And where we talk about the Child Care and Protection Act, there are so many places for that support to actually happen. So I think that we need to be focused on, for example, removing Section 24, talking about uncontrollable children, rethinking how we are going to be putting children in adult facilities, remand facilities. So, we have plenty to focus on rather than further criminalizing a child. But I wanted to bring up one other item before we do our trivia and our right of the day. Right before we do that, I want to talk about the DNA Evidence Act. There was an article. I'm not going to speak to the merits of the claim, but there was an article of a man talking about his experience leaving a correctional facility and having to forcibly give a DNA sample. While the DNA Evidence Act does allow for reasonable force when collecting a sample, we've always had at JFJ reservations about what that reasonable force should look like, whether or not it is being properly monitored, and we cannot agree that reasonable force can escalate to what is an assault. So what we are hoping is for an amendment of the act. We know that there is some amendments coming, but we would want to see an amendment that focuses on ensuring the safety of the person when it is that reasonable force must be used. And one of the issues that we would have taken is that one of the persons that can observe one of those forcible collections of samples is a authorized officer, who the authorized officer is usually the person that is on the case involved in the sample. So with that kind of thing, we are hoping that that person is removed from those persons that is allowed to observe the instance, and it be limited to justices of the peace or the attorney at law of the person from whom the sample is being requested. I'm gonna leave it there. My producer is wrapping me up. So we're gonna go straight into our right of the day this week. And keeping with the issue of children, we talk about the need to report a child who is in need of care and protection. So where a person has any information that causes them to suspect that a child has been or is likely to be abandoned, neglected, physically or sexually is ill-treated, or is otherwise in need of care and protection, they should make a report to the Children's Registry. So that is a duty that can actually bring a penalty if it is breached. Do you happen to have the penalty in mind, Sherika?
I do not have this penalty in mind.
Yes, but it is a duty that brings a penalty if it is found out that you failed in that duty. So be mindful of this. And we'll go straight into our trivia question for the week, which is, what is the age of criminal responsibility? Right, so when do you start to be able to be charged for a crime? So you can respond to this question by sending us a DM on our social media pages, which is JA for Justice, or you can send us a WhatsApp to 239-7583, and the first correct answer will be the winner of $1,000 credit. Yeah.
Can I enter the trivia?
Absolutely not. Okay, so we go straight into our topic for the week, which, as I said, is exploring sexual and reproductive health rights of children. So the youth population between the ages of 10 and 24 make up about a third of the overall population of the nation. And the data coming from the National Family Planning Board reveals that there are numerous issues that are negatively affecting the youth population, but chief among them is the early stage at which they are exposed to sexual activity and their lack of knowledge with the risks associated with those activities.
So the data is also revealing that approximately 1% of the youth population is affected by HIV and other STIs. The most recent Knowledge, Attitudes and Behavior Practices study of 2017 by the Ministry of Health and Wellness actually showed a decline in the knowledge of HIV in the youth cohort. And this definitely speaks to a need for targeted interventions for this group, as it's even been reflected in the new cases of HIV that are reported each year.
Of further concern is the limited avenues in which youth can be engaged on the topic of sexual and reproductive health, and comprehensive sexuality education continues to have limited engagement in most schools.
So our questions today include, would increased sensitization and knowledge actually have an effect on the rate of infection of young persons? What are some of the sexual and reproductive health rights of our children and youth? What barriers do they face? What does age-appropriate conversations look like in schools and within the homes?
So with us this week to discuss, we have Christian Levine, the Care and Counseling Director from E4Life. Christian, are you with us?
Yes, I'm with you. Good afternoon.
Good
Hi,
afternoon. So I just want to start out. We only have a minute before the break, but I just want to ask you the first question. They said that they're seeing an increase in early sexual debut. Is that something you're seeing in your work at E4Life?
Yes and no. In the sense that we do have a lot of young adolescents, a lot of young girls, young women who are quite empowered, and we do provide them with adequate information and they utilize this information. And then, you may see others who, beg to differ. So I guess it's going to be a 50-50 type of thing,
Okay.
situation.
I see.
Mhm.
All right. So like I said, we're coming up on the break. So when we come back, I am gonna ask you what are some of the issues that you are seeing with your clients at E4 Life first of all, and then we'll go into some further details. Welcome back to Let's Talk Justice. We are joined by Christian Levine. And before we get back into our interview, I just want to remind our listeners that this is a show that you can participate in. So if you have questions or comments, you can send your comments to our WhatsApp at 2397583, or you can call in studio at 676-4996. So Christian, before we went on break, you were about to give us the download. What's going on with the clients that you are seeing at E4 Life? What are the issues that you've identified that we should address with youth and women and girls in particular?
Okay. So, some of the issues do remain the same. We have new arising issues. And but I'm going to try to keep it as concise as possible. I know we have time limitations. I'm just going to pull on a few of the issues that our young girls and our women are being affected with at this time. And I would like to bring to the core access to family planning services. And when I speak about family planning, I'm talking about having the full autonomy over one's body to decide upon the timing that you want to get pregnant, the spacing, and also the number of children. So when, as a case manager or a care and counselor director, and I hear that a young woman who is 23 years old, who have 3 children and is requesting for tubal ligation and is denied this type of service because she has not yet been married or would need spousal consent for this procedure to be done, it just begs to differ that the work that would have been put in from 1994 through the ICPD plan of action is that we're taking a step back, because how can you say to this young lady, you do not have the right to decide to make this decision. You do not have full autonomy over your body to make this decision because you do not have a spousal consent or you have not yet been married. You're not able to make this type of decision as it relates to family planning and deciding not to have more children. So having the right to access family planning service is a recurring issue affecting our girls, and also having access to youth-friendly spaces and commodities is also a prevalent issue. Having access to something as simple as a condom. An adolescent may be scared to go into a pharmacy to have this type of conversation with the healthcare provider that is present because they believe that they will be turned on for requesting this type of commodity. And then even the legal ramifications around it, providing this level of service to these young persons. We see that the healthcare providers themselves are a little weary or a little scared to provide certain level of sexual and reproductive health service to our youth. So that is also an issue that we see that is always constantly coming up. So if we have a case whereby a young girl may see that she has contracted a STI, where will she go? Are you going, if she visit this health center, what is the percentage that she will be told that, hey, you need to return with someone who is an adult? Do you think that this young girl will really return with a parent or a guardian?
Yes, it's one of the issues that we kind of recognized. I have worked in the HIV sector before, and one of the issues was, this younger girls, they're past the age of what is the age of consent, which is 16, but when they come to seek our services, there is this gray area. Are we allowed to treat them without the parental presence? And nobody wants to implicate themselves in service of this child and end up not being able to serve anyone else in the future. So
I mean, this is also quite interesting to me because I also know that there is legislation that supports that children at 16 are supposed to be able to make decisions around their sexual health, because that is the age of consent, and we do acknowledge that children are engaging in sexual activity at that point, and so it only makes sense that they're also able to access the sexual health services that come with that kind of activity, or that they should be able to access when engaging in that kind of activity. So I wanted to ask you, Christian, we already have that kind of legislation in place, and then we still have this fear that healthcare workers have. So how do we go about tackling that issue? How can we start to resolve that problem?
So not until we get to a point where there is legislative change and the legislation matches the reality of what is taking place with our youth population, with our young women, we will definitely still remain in a dark place, as Jade would have mentioned before. So it doesn't make any sense that there is early initiation or sexual debut, and then, as you mentioned before, one is able to consent to sex at age 16. However, when you look at the other piece of legislation, it would speak to someone being having to be, 18 years old to be classified as an adult. So the discrepancies in the different pieces of legislation, until we have that matching what is taking place and what the data is showing, because the data is showing that adolescents 15 to 19 years old are having riskier sexual behaviors, sexual practices. And so, as I said, until there is some sort of balance, and the legislation speak to what is happening and what the data is showing, we will remain in some sort of trouble.
So I would like to mention that the Law Reform Age of Majority Act does say that at 16 that we should treat those children at 16 as though they were 18 when they are trying to access those kinds of services. And so I do see that exists in the legislation. And so I think where I will join with you from Jamaica Youth Advocacy Network's position is to say that since we still have that kind of fear with the healthcare workers, with that kind of legislation in place, then I do agree with you that there should be some kind of indemnification clause for healthcare workers that says, if a healthcare worker engages with a child in providing medical services at 16, then they are indemnified from liability from,
any legal repercussions
from that. And so then I hear you in that the legislation does need to match with their reality to say, even though we know they should be able to access the service at 16, they still can't. So there's something else that's needed.
So, a lot of what I'm hearing you say, Christian, is that there are adolescents with the knowledge, but they still are not able to access the services. Because I am surprised to hear that we're still having issues with accessing contraceptives. For example, can you tell me some more about your experience with that? Like, what exactly is the justification?
So you would hear from some of our girls, Miss, I went to the pharmacy and I went to see if I could purchase a condom. And first of all, I'm asked, how old are you? And if I say that, Miss, I'm 15 or I'm 16-year-old, then I'll get a roll eye, or I'm told that I cannot be sold this item. So a lot of our young girls basically would benefit from these commodities when we have them in house, and we also hear young girls who access services through the healthcare, through certain health centers. They do raise this to say that, Miss, I still can't get access to a condom. I still feel as if like I'm asking for the world when I ask for a condom.
Well, okay. So outside of even the access, because even with those adolescents, we're talking about people that know, right? So in your experience, because I know IFA Life has done training and sensitization with young persons before. I'm not sure what your scale is at right now. Are you still seeing a large number of adolescents in your experience that are not exposed to the information, or is it just a matter of access that's hindering them?
Well, speaking from an IFA Life perspective and the work that we have been doing with our young people, we would have provided them with adequate information, we would have built their capacities, we would have empowered them and provided them with adequate information so that they are able to make more informed decisions and choices. And so you have some young people who understand and know their rights and know what it means to have access to sexual and reproductive health services. And so some of them would be able to navigate certain spaces when having these conversations with healthcare providers or with the pharmacies. But you do still have a couple of young people who they're not as empowered as the others, and this does not mean that they're not having sexual intercourse.
Yes.
Right. So do you find that when you give them this kind of information, well, first, maybe I should ask, what are the topics that you cover in your training? So what do you tell adolescents about their sexual and reproductive health?
So we basically provide them with preventative information, information around HIV management, information around STIs, more so around safer sexual practices. We do incorporate other information around skill building and having peer-to-peer conversation on a daily basis when we're having like our support group meetings with these young people, just to provide them with a space where they can actually be young people and they can actually have fun and have just regular engagement, whether it's about our own education, our own school. So the conversation doesn't solely lie with just around sex or sexual practices or around HIV management. They're about HIV literacy. It encompasses a lot of things because we understand that for us to reach young people, it has to be an integrated approach. So we're not going to take young people in a room and tell them, hey, you should not be having sex, or you should not be doing this, or you should not be. We provide them with the adequate information and provide them with preventative information so they are able to make informed decisions and choices.
All right, Christian, I'm going to ask you to pause there. We're going to go to the break, but I want you to stay with us. I know we said you would be done by now, but I want you to stay with us because we just have a few more questions after the break. Welcome back to Let's Talk Justice. We are joined by Christian Levine from the IFA Life Care and Counseling Director, and we're talking about sexual and reproductive health of children and youth. I know Sharika has a burning follow-up she wanted to ask.
I just wanted to know, Christian, after you give the children this kind of information, do you recognize that there is any change in the behavior?
Extent where we have young people who are part of our program who are advocates. So these young people, they're so empowered, given that we would have given them extensive training and capacity building training, as I had mentioned before, and they're able to even advocate for other young people. One of the ongoing programs that we have is the Smart Club, and what this means is self-motivated and responsible teens, and persons who are within this club ranges from ages 8 to 19. However, our initiatives would have been, or the age cohorts, based on our program initiatives, would have been 8 to 12 years and then, 13 to 19 years. And we would have, these persons would have been exposed, as I said, to different level of information. I would have mentioned before HIV management and literacy, child rights information and leadership information. And so, as I mentioned, like the conversation would not only include information around sexual and reproductive health per se, specifically focusing on around HIV and STI, but also providing them with adequate information for them to be able to stand up and speak for themselves and also for their peers.
As is
So
their right.
I strongly believe that this program that we have going on is really blossoming some strong advocates and activists. So I feel good that when I exit this space, we would have groomed young persons who are coming up behind us who will be able to carry on the baton.
Okay.
So I want to ask you, how would I, as a young person, get in touch with E for Life? Like, how do I get involved with the program? How can I be empowered?
Okay. Question: have you seen our wonderful website that is up and running now?
No. Please tell us all about it.
You should check out our website, Jade. It has a tab there that takes you to exactly where you just asked a while ago, how you want to get involved, like the nature of involvement, or if you just want to pick up your phone and call us, we're easy to get through to 62005, and it goes all the way up to 6, and then other officers' information, contact information would also be on the website, and it's www.eforlife.org.
So E for Life is only in Kingston?
No, we have our work stretches across four chapters, 4 parts. So we have Kingston, which would be Eastern, Kingston and St. Anne, and we also have chapters in Westmoreland and St. James. However, we still serve clients outside of these parishes, but they would be linked to these specific chapters.
Okay. Awesome.
I wanted to know, outside of E for Life, and even I'm aware of other agencies, even like UNICEF, that has a teen hub that offers some of this kind of information that you're speaking about as well. Do you know of any government services or places, public entities that have this kind of information available to young people or adolescents?
Could you repeat? You're asking me could you repeat that question?
If you know of anywhere that this kind of information or something like the program that you do is available to young people outside of the programs that NGOs put on, is there anything by the government or anything in schools or any other program happening where young people could access this kind of information?
Well, you touched on a very important point there. In schools, you have a lot of clubs, and I know that a lot of the NGOs do go into the schools and provide these information. And at some point, I believe they also train persons within the schools. I know that this information is also accessible in the schools. As it relates to other organizations, if you realize the NGO sector is kind of like-minded, and even the government sector, so you're going to have a lot of organizations that provide this level of information. The youth, the YICs, the different branches within the ministry that
Seem to be having some technical challenges with Christian there. But I think what she was getting at the end there is that there are quite a few agencies involved, but I'm still not hearing the government agencies, which I think is the root of your question. So I'm hoping we can get her back soon. Is she back?
And I know that I was invited St. Mary Youth, the branches under the ministry.
Oh, okay.
Hello?
We couldn't hear you for a second.
Yes, we lost you for a second there. But I think you were saying at the end there are some branches of the ministry that are involved in giving this kind of information as well?
Yes, because I've been invited to have this level of conversation, similar conversations with persons, especially during the COVID period. I did a lot of sessions online with young people. So you do have the ministry working with young people in this regard. As I would have mentioned, you have other NGOs that provide this level of information. I know that Jamaica Family Planning Association. They have a very active youth arm called the Youth Advocacy Movement. They also go into communities, go into schools, and they provide this level of information as well. So the different agencies and the stakeholders are there providing the information on the ground.
Awesome.
Well, it's our position at Jamaica Youth Advocacy Network, and I want to know, Christian, if this is something you agree with as well, that comprehensive sexuality education should be something that's provided in schools, especially because young people are dealing with so many competing sources of information as well as on social media, that, you know, we are often so lost in even trying to get them back to some form of accuracy around this kind of information when they've learned so much misinformation from places like the internet. So we think that there needs to be some trusted source that is giving children this information in a place where they are all able to access. And the easiest space, that seems like to us, is schools. So is that something that you would agree with as well at E for Life, that this should be a part of the curriculum at schools?
As it relates to accessing information, I would have mentioned before access to youth-friendly services and commodities. So in that, it doesn't only mean access to the physical commodity, but also access to accurate information, and this would include comprehensive sexuality education. I know that the ministry would have been doing a lot of work with trying to make the curriculum more comprehensive and capturing additional information. So we would really love to see something that would cover the realities of the young people, and that would be able to better guide them. But guess what? We also want to get to a point where the teachers themselves are comfortable to deliver this information. So yes, we may have a curriculum, or yes, say for instance, we have CSE, but do we have the bodies to deliver, willing bodies to deliver this level of information? So we also need to get there and to include that in the conversation as well.
I so agree with you on that point, because I think so much of what's happening around young people and the way that they're unable to access sexual health services is really just about the attitudes and behaviors towards them when they try to access these services. And so if that's something that we can tackle, to recognize that young people actually have the right to this kind of information and the right to access this kind of service since they are engaging in sexual activity, then I think that would take us a far way.
Wow, all right. So thank you so much, Christian. I say, Sharika, turn yourself into a partial interview.
I'm so used to being on the other side of this.
So, Christian, I want to thank you so much for joining us and sharing some of E for Life's perspective in this issue. I just want to ask if you have any final words for listeners.
I just want to say that, I'm hoping that persons who are part of the legislative bodies are here listening, and just want them to know that first, to provide comprehensive sexual and reproductive health care to our young people and our young women, we must have an integrated approach. So healthcare workers shouldn't be working in silos, NGOs shouldn't be working in silos, the government shouldn't be working in it, but we must have a collaborative approach to ensure that this population is being served, and even the wider population, because access to health is a human right, it's a fundamental human right. And so if we're going to do it, let's do it right. Let's do it in a way that it is comprehensive, it's accessible to all, and so that everybody can live fulfilled lives.
Definitely.
And that's it from me.
Awesome. Thank you so much again. That was Christian Levine from E for Life. We are coming up on our next break, and when we come back, we will be taking your calls if you are calling in, so we're listening out. Welcome back to Let's Talk Justice. I think we just had a very interesting discussion with E for Life about sexual and reproductive health rights of children and youth. I think one of the things that has continued to come up is the access. So funnily enough, in our research that was done for the script, they highlighted that the knowledge wasn't there. That's coming from the Health and Attitude Survey.
Right.
That was done in 2017. But what we're hearing from those on the ground is that the knowledge is there. It's the access that's not there.
Right.
So, I mean, I know that you're working with young people on a regular basis, Sharika. Do you have any similar observation?
Well, to be honest, sexual and reproductive health rights is not something that JN has been doing in the last year, actively engaging young people around, but it is something that we are actually restarting at the end of this month. Actually, we're going to be having a training for the first in a long time around sexual and reproductive health rights, and especially in terms of trying to increase young people's literacy around HIV. And I think that's just because we also saw some data that was saying that young people are actually becoming a key population as it relates to the prevalence of HIV, and that was really concerning to us because if young people are contracting HIV at such an early stage, that doesn't speak very well to their future health outcomes, and just in terms of their the right that children have to the highest attainable standard of health, that's not an outcome that sits very well with us. So it's definitely something that we want to start doing more of, to engage young people more around their sexual and reproductive health and rights. And that definitely involves giving them information, because there aren't a lot of accessible spaces where young people can have this kind of information. And that's something that we are seeing, that even though in NGO spaces we're trying our best to give young people this information, there's no place where we can say that every single child can access this kind of information without any barrier. And we think the easiest place to do that would be at school. We have that legislation that says every child has to go to school, and it's such a regulated space already, and we're able to control so much in schools, especially in terms of the accuracy of the information that is given there. And so I think it's an ideal space that children can be taught about their sexual health, because they have the right to make informed decisions around their sexual health. And how do you make informed decisions if you don't have information?
Yeah, we agree. Definitely agree from a JFJ perspective. But I think I did also see that that study, that rising in numbers of HIV infections. And I think one of my challenges with it is the misinformation. I think you alluded to it in the interview as well, because sometimes it's not a lack of information, it is the incorrect information that you would have. I've seen all the memes of people not really understanding HIV, how it is actually transmitted. People thinking that you can use alternative medicine. I'm using that term very generously, but alternative medicine, just some random ways to cure themselves. And of concern, of course, is there's still a perpetual myth about having sex with a virgin, which would be unprotected sex.
Right. And so there's also these harmful ideas around HIV and around sex and sexual health. And so that's definitely something we have to start tackling. But something that is exacerbating that issue is just the access that we now have to the internet. Young people are so on the internet that I even heard recently that TikTok is being used as a search engine. So we're even looking for information in places where information can't be verified. And that is extremely concerning. If young people don't have that space where they're getting this information, then they will go in search of information that most times they can't verify the accuracy of, and that's really concerning if you have them engaging in sexual activity, which, as we know, for in a lot of instances can end up being a life or death situation, depending on whatever STIs contracted, or even just a situation that will diminish the quality of life that the person is able to live as they continue their life, and so this is something we should definitely be concerned about.
Another thing I wanted to discuss around child health, Well, we did touch on it a bit, but it is the parental involvement, and I want to move a bit outside of the sexual and reproductive health, because I remember certain discussions when COVID-19 was at its height, children wanting to be vaccinated and they are not able to because they are not getting parental consent. I mean, what is Jayan's position on that?
It was our position back then and still is our position now that we should recognize that there is that legislation that I was speaking to earlier in the Law Reform Age of Majority Act that says that once children are at 16, that they should be able to make decisions around their sexual reproductive. I think it also says dental. Don't quote me on that. Health. As though they were 18. And so at 16, they should be able to make these decisions. But we recognize that the parents are not there yet, because even though children are able to make those decisions, there are many other things that have to go into play for them to even have the access to the place that they're able to make the decision. So, stuff like who is going to carry you to the doctor? How are you going to get there? Where do you get the money from to pay for the taxi to even go to the doctor? Stuff like that. So even though we acknowledge that they do have that right, there are still barriers around their access just because they don't have the complete agency to do certain things. They aren't making their own money. So even if they end up getting a prescription at the doctor, who is going to fill that prescription? And so parents also really have a role to play in helping their children to be empowered. And so parents have to be a part of that process and are expected to be a part of that process, even though you start empowering the child more around those decisions at that age. And I also want to emphasize that it's not a random age. We don't say 16 just because we think that 16 is supposed to be an appropriate age, but it's actually through research, their cognitive abilities at that age and what they're able to understand about the risks associated with sex. At 16, they are taken to have, the appropriate level of understanding to engage in these discussions. And so why not give them the information to do so and allow them to access the services that help them to do so? So I think that only makes sense to do.
And I appreciate your impassioned monologue. I think we can clearly identify who is a regular youth advocate focused in that area, clearly abreast with the issues. But one thing, because I don't want to do Jay a disservice, what you have been working in is nutrition.
Right.
So how do you find the landscape of child rights around food, for example, in Jamaica? You have a very short time to tell us.
The landscape around food. So everyone agrees that children should have access to adequate food, right? I think what's also missing in that conversation is information. In Jamaica, we have a real issue as it relates to information. The way that people, are able to access information and accurate information too. And so even in that space, we're finding that most of the issues are happening because people don't have accurate information around the food that they're eating and around what they should be eating. And also legislation that supports getting that kind of accurate information.
Yeah, but why you need to know where nobody's sick? Are we sick?
Yes, Jamaica is very sick. We do have a really big problem with NCDs, non-communicable diseases. 1 in 3 Jamaicans has hypertension. 1 in 8 Jamaicans is suffering from diabetes.
The children as well?
In 2017, actually 30,000 children were diagnosed with hypertension. Okay. And so that's quite concerning. Hypertension is usually something that affects older people, as we, have said over the years. But now we're seeing that it's affecting younger people. And so all the health issues are now coming to affect young people. We have these sexual and reproductive health issues. We have issues as it relates to nutrition. We have mental health issues. It's just generally there needs to be more of a focus on youth health in a more holistic way. Young people are people too, in the fullest sense of that word.
Absolutely.
And also deserve their right to health to be recognized completely. And so we have to start looking at the different areas and, really tackling them as they deserve to be tackled.
Wow. Okay. Thank you so much, Sharika.
Thank you for having me as a co-host today. Really appreciate the opportunity.
Well, yeah, it was a good exchange, and I appreciate having someone that has the knowledge here to assist me. My producer has nudged me, so I don't forget. I appreciate that, producer. Our trivia question today was, what is the age of criminal responsibility? And the response to that is 12. And we have 3 minutes left in the show, and I just want to take this time to remake the point that the 20 years that they're proposing in the Child Care and Protection Act to be a mandatory sentence would start with a 12-year-old. Because that is the age of majority. So, Confident Palmer, you were the winner of our trivia, so you will be getting your $1,000 credit. So look out for your message on Instagram. Yes. But yes, I just want us to keep in mind, look at our legislative proposals as they are coming in. We spoke at length about the Firearms Act and the way that would affect children, a mandatory 15-year sentence for possession. And we're now looking at another mandatory 20 years. I mean, we have to consider what our rehabilitation options are, and if we can implement those after you put a child in what is essentially a criminal college for at such an early age for such a long time,
especially with the kinds of inhumane conditions too.
Absolutely. So we're out of time, but thank you so much for joining us this week. We're hoping to keep it on the child's rights theme for this month. So join us again next week when our regular host, Mikkel, will be back to join me. So it was Let's Talk Justice. I am Jade Williams, and I was joined by
Sharika Mills.
And we'll see you next week, 1 p.m. Tuesday, same time.